Welcome back, future nurses. You have made it to practice test 24 in our high-impact 30-day NCLEX challenge, and that means you are seriously leveling up your nursing game. By this point, your clinical judgment is sharper, your critical thinking is faster, and your confidence is growing with every single question you tackle. Today's test brings another carefully designed set of high-yield questions that reflect the style, tone, and difficulty of the real NCLEX. Stay locked in, keep pushing forward, and believe in the preparation you have been putting in day after day. And if you are loving this challenge, do not forget to claim your free 5-day access to our complete NCLEX crash course. Just tap the WhatsApp link in the description and say hi to get started. All right, it is time to dive into practice test 24 and show just how far you have come. Let us begin. Question 1. To kick off this NCLEX style review, let us look at a scenario involving a common blood pressure medication and a surprising dietary interaction that demands immediate nursing attention. A client who has recently been started on amlodipine for hypertension has also been advised to follow lifestyle changes to help with blood pressure control. During a routine check-in, the nurse asks about the client's progress and habits. Which of the following statements made by the client should prompt the nurse to provide immediate follow-up education? The options are as follows. Option A says, "I've started going to the gym and I'm working with a nutritionist on meal planning." Option B states, "I normally take my amlodipine with a glass of grapefruit juice every morning." Option C asks, "Can you guide me on how to stay consistent with my medication and exercise routine?" Option D mentions, "I notice I sometimes feel slightly dizzy after taking my blood pressure medicine." Among these, the correct answer is option B, "I normally take my amlodipine with a glass of grapefruit juice every morning." Now here is the rationale. Grapefruit juice is known to inhibit the cytochrome P450 enzyme system, particularly CYP3A4, which is responsible for breaking down many medications, including calcium channel blockers like amlodipine. Consequently, when grapefruit juice is taken along with amlodipine, the drug is not metabolized efficiently, resulting in elevated serum levels. Question 2. Moving into a neonatal priority scenario, let us focus on the immediate nursing care required for a newborn with a critical congenital condition. A newborn has just been admitted with a diagnosed myelomeningocele, a form of spina bifida, in which the spinal cord and meninges protrude through an opening in the spine. Before surgical repair, it is essential to protect the integrity of the exposed sac to prevent complications. So, which of the following nursing actions is most appropriate to ensure safe preoperative care? The options include option A, irrigating the sac with cold normal saline. Option B, using petroleum jelly as a protective layer over the sac. Option C, placing a sterile, saline-moistened dressing over the sac. And option D, applying a dry, sterile dressing to shield the sac from injury. The correct answer here is option C. Place a sterile, saline-moistened dressing over the sac. Let us understand why. The primary goal in the care of a newborn with myelomeningocele is to prevent the sac from drying out, rupturing, or becoming infected. A sterile, non-adherent dressing soaked in warm, normal saline maintains moisture, preserves tissue integrity, and provides a barrier against contamination. Question 3. Let us now focus on a high-stakes safety concern involving blood transfusions, where one clerical mistake can result in a life-threatening outcome. During an in-service session on transfusion safety, the nurse addresses strategies to prevent fatal complications. Which of the following actions is most effective in preventing an ABO-incompatible, or hemolytic, transfusion reaction? The answer choices include option A, prime the Y-set tubing with normal saline before transfusion. Option B, use a 20-gauge intravenous catheter to ensure proper vascular access. Option C, label and match the client's specimen correctly for blood cross-matching. And option D, review the client's medication allergy history thoroughly. The correct answer is option C, label and match the client's specimen correctly for blood cross-matching. Here is the rationale. ABO-incompatible transfusion reactions, though rare, are almost always preventable and are most often the result of human error, specifically clerical mistakes such as mislabeled blood specimens or incorrect client identification. A mismatch in blood type can trigger a rapid immune response where the recipient's body destroys the incompatible red blood cells, leading to acute hemolysis. This can cause fever, chills, back pain, hypotension, renal failure, or even death. Therefore, the nurse must emphasize the importance of strict verification procedures during blood typing and cross-matching. Question 4. Next, let us turn our attention to a fundamental assessment skill used during prenatal care. The nurse is preparing to perform Leopold maneuvers on a pregnant client during a routine antenatal visit. So, what is the primary purpose of this clinical technique? The available options are as follows. Option A, to determine the position and presentation of the fetus. Option B, to reduce the risk of pressure on the inferior vena cava. Option C, to assess how well the uterus is shrinking postpartum. And option D, to check whether the amniotic membranes have ruptured. Among these, the correct answer is option A, to determine the position and presentation of the fetus. Now let us dive into the rationale. Leopold maneuvers are a systematic 4-step method of palpating the maternal abdomen to assess fetal lie, presentation, and position. This non-invasive technique helps the clinician determine whether the fetus is in a cephalic, breech, or transverse position, information that is essential for labor planning and delivery preparation. Leopold maneuvers become more reliable after 36 weeks of gestation when the fetus is larger and less mobile. Question 5. Continuing with another high-priority public health scenario, let us examine infection control strategies during an outbreak situation. The nurse is participating in an infection control response team, managing a norovirus outbreak in a long-term care facility. In this setting, which of the following actions would be the most effective recommendation to limit further transmission of the virus? The options are: Option A, place face shields outside resident rooms. Option B, remove unnecessary urinary catheters. Option C, clean surfaces using hot, soapy water. And Option D, increase the frequency of environmental disinfection in care areas. The most appropriate and effective answer is Option D, increase the frequency of environmental disinfection in care areas. Now, let us understand why. Norovirus is a highly contagious virus that spreads easily through direct contact with infected individuals, contaminated food, and most importantly, in institutional settings, contaminated surfaces. It can survive on environmental surfaces for days, and even minimal exposure can lead to infection. Therefore, enhance environmental cleaning using an EPA-approved disinfectant, especially bleach-based products, is critical during an outbreak. Surfaces should be disinfected frequently and thoroughly to interrupt the transmission cycle. Hey there! Quick reminder. Before we move on, if you are serious about passing the NCLEX, we have something you are going to love. For a limited time, you can get free 5-day access to our complete NCLEX crash course. No credit card needed. Just pure, high-yield resources like over 5,000 NCLEX-style questions, live and recorded review classes, step-by-step case study breakdowns, study guides, and personalized study plans. All you have to do is click the WhatsApp link in the description and type "Hi" to get instant access. So, if you want expert-level prep without the pressure, now is your moment. Let us get back to the test. Question 6. Shifting now to a post-operative care scenario, let us assess how to determine whether a client is on track for discharge following major orthopedic surgery. The nurse is evaluating a client who is 24 hours post-operative after undergoing a left total knee replacement. Which of the following findings would best indicate that the client is progressing well and may be ready for discharge? The options are as follows. Option A, heart rate 102 beats per minute, respiratory rate 18 breaths per minute, and blood pressure 104/72 millimeters of mercury. Option B, urine output of 200 milliliters over the past 8 hours. Option C, clear lung sounds heard at both bases. And Option D, reports left knee pain as 8 out of 10 on the pain scale. The correct answer is Option C, clear lung sounds heard at both bases. Now, let us explore the rationale. After any major surgery, particularly one requiring limited mobility, like a total knee replacement, respiratory complications such as atelectasis or fluid retention can pose serious risks. The presence of clear bilateral lung sounds is an excellent indicator that the client is maintaining effective ventilation and oxygenation and is not experiencing pulmonary complications. This finding supports safe discharge planning as it reflects a stable respiratory status. Question 7. Let us now turn to an endocrine emergency that demands swift clinical intervention. Thyroid storm, a life-threatening complication of hyperthyroidism. The nurse is caring for a client who is exhibiting classic signs of this condition, including severe hypertension, tachycardia, fever, and agitation. In this scenario, Which medication should the nurse anticipate requesting from the healthcare provider to help stabilize the client? The available options are Option A, enalapril, Option B, calcium gluconate, Option C, levothyroxine, and Option D, propranolol. The correct answer is Option D, propranolol. Here's the rationale. Propranolol is a non-selective beta blocker that provides rapid symptom relief in thyroid storm by lowering heart rate, reducing blood pressure, and mitigating the peripheral effects of circulating thyroid hormones. It is one of the first-line medications used to manage the cardiovascular manifestations of this critical endocrine emergency. Question 8. Now let us turn our focus to pediatric nutrition, specifically for children with chronic conditions requiring specialized diets. When educating parents of a child with cystic fibrosis, the nurse must recommend snacks that align with the child's unique nutritional needs. So, which of the following snacks would be most appropriate for the nurse to suggest? The choices are Option A, slices of pineapple, Option B, carrot sticks and fat-free ranch dressing, Option C, celery sticks and peanut butter, and Option D, gelatin. The best answer is Option C, celery sticks and peanut butter. Here is why. Children with cystic fibrosis suffer from pancreatic insufficiency, which impairs the digestion and absorption of fats and other nutrients. As a result, they require high-calorie, high-fat, and high-protein diets to support adequate growth, energy levels, and lung function. Peanut butter is a calorie-dense food that provides both healthy fats and protein, making it an ideal dietary addition. When paired with celery, it offers both nutritional value and a kid-friendly texture. Question 9. Next, let us apply some essential medication math to a real-world intravenous infusion scenario that nurses commonly face. He nurses caring for a client who is receiving 1,300 units per hour of heparin, and the infusion bag is labeled 25,000 units in 500 milliliters of dextrose 5% in water. The question is, how many milliliters should the nurse document that the client received over a total of 8 hours? To calculate this, we must first determine the rate of infusion in milliliters per hour. Using the formula for dosage calculation, we divide the ordered units per hour by the total units in the bag and then multiply by the total volume. 1,300 divided by 25,000 multiplied by 500 equals 26 milliliters per hour. Once we have the hourly rate, we simply multiply that by 8 hours. 26 multiplied by 8 equals 208 milliliters. Question 10. Let us now explore a key assessment point in the ongoing care of pediatric clients with chronic conditions, specifically cystic fibrosis. The nurse is preparing to assess a child with cystic fibrosis during a routine outpatient clinic visit. In this situation, which routine laboratory test does the nurse anticipate the primary healthcare provider will most likely order? The options include Option A, blood glucose, Option B, total cholesterol, Option C, 24-hour urine, and Option D, blood cultures. The correct answer is Option A, blood glucose. Now, here's the rationale. Children with cystic fibrosis are at increased risk for developing cystic fibrosis-related diabetes, CFRD, due to chronic damage to the pancreas that impairs insulin production. As a result, routine monitoring of blood glucose levels is essential for early detection and management of this complication. In clinical practice, both random blood glucose and hemoglobin, A1C, are commonly ordered, especially if the child is experiencing weight loss, delayed growth, or increased fatigue. A random blood glucose result greater than 200 milligrams per deciliter is considered abnormal and should prompt further evaluation for diabetes. Question 11. Now let us turn to a high-acuity clinical setting involving mechanical ventilation and its hemodynamic effects. The nurse is caring for a client who is receiving mechanical ventilation with positive end expiratory pressure, PAPE. In this scenario, the nurse should be especially vigilant for which potential complication associated with PEEP therapy. The available choices are Option A, decreased mean arterial pressure, Option B, increased preload, Option C, increased partial pressure of oxygen, and Option D, increased gas exchange. The correct answer is Option A, decreased mean arterial pressure. Here is the rationale. While PEEP is essential in improving oxygenation by keeping alveoli open during expiration, it also raises intrathoracic pressure, which can impede venous return to the heart. This decrease in venous return results in reduced preload, which subsequently lowers cardiac output. When cardiac output drops, mean arterial pressure, MAP, can fall as a direct consequence, posing a risk for hypotension and impaired perfusion to vital organs. Question 12. Let us now explore a pediatric nutrition question related to bone health and growth. The nurse is caring for a child diagnosed with rickets, a condition characterized by defective bone mineralization. In planning the child's care, which dietary intervention should the nurse anticipate, including in the care plan? The options are as follows. Option A, increasing dietary intake of vitamin D-rich foods. Option B, limiting dietary intake of calcium-rich foods. Option C, encouraging consumption of foods rich in phosphorus. And option D, promoting a high-protein diet. The correct answer is option A, increasing dietary intake of vitamin D-rich foods. Here is the rationale. Rickets most commonly results from a vitamin D deficiency, which impairs the intestinal absorption of both calcium and phosphorus, two minerals essential for strong, healthy bone formation. Without adequate vitamin D, children are at risk of skeletal deformities, delayed growth, and bone pain due to insufficient mineralization of the growing bones. Therefore, nutritional strategies focus on increasing sources of vitamin D such as fortified milk, egg yolks, fatty fish, and safe sunlight exposure. Question 13. Let us now take a closer look at a question involving levels of prevention, specifically tertiary prevention in oncology care. The nurse is counseling a client who has been diagnosed with breast cancer, and the goal is to recommend a measure that aligns with tertiary prevention. So, which of the following should the nurse suggest in this case? The answer choices are option A, reviewing breast cancer risk factors with the client's family, option B, assessing the unaffected breast for abnormalities, option C, recommending the client's daughter get screened for the BRCA1 or BRCA2 gene, and option D, attending a local support group. The correct answer is option D, attending a local support group. Now let us break down the rationale. Tertiary prevention focuses on minimizing the long-term effects of an existing illness, reducing complications, and improving the client's quality of life. For clients with breast cancer, this includes interventions like rehabilitation, emotional support, and long-term symptom management. A support group provides psychosocial assistance, enhances emotional well-being, and helps clients navigate life after diagnosis or treatment. In contrast, question 14. Turning now to a pharmacological red flag, let us examine a potential adverse effect of a widely prescribed medication for hyperlipidemia. A client who recently began taking atorvastatin reports new onset leg pain. In this situation, what should the nurse advise the client to do next? The possible responses are option A, continue the medication as it is a common side effect. Option B, discontinue the drug and visit the clinic next week. Option C, take a warm shower and stretch. And option D, stop the medication and seek immediate emergency care. The correct answer is option D, stop the medication and seek immediate emergency care. Here is the rationale. Although mild muscle discomfort can occur with statins, sudden, severe, or unexplained muscle pain is a hallmark warning sign of a serious adverse reaction, either myopathy or its life-threatening progression to rhabdomyolysis. In rhabdomyolysis, muscle fibers break down and release myoglobin into the bloodstream, which is highly toxic to the kidneys. If not addressed promptly, this can lead to acute kidney injury and potentially irreversible renal damage. Question 15. Let us now turn to an important client education scenario involving chronic low back pain, a condition that requires careful attention to posture, lifestyle, and movement patterns. The nurse is teaching a client how to manage this condition effectively. Which of the following statements made by the client indicates a need for correction? The options include option A, I am planning to stop smoking. Option B, I should sleep on my stomach. Option C, I bought a firm mattress. And option D, I will bend my knees when lifting. The correct answer is option B, I should sleep on my stomach. Here is the rationale. Sleeping on the stomach is discouraged for clients with low back pain because it tends to exaggerate lumbar lordosis, or the inward curvature of the lower spine. This posture increases strain on spinal structures and surrounding muscles and often leads to stiffness or worsened pain upon waking. Additionally, it forces the neck into prolonged rotation, which can cause cervical strain. Pause for a second. Feeling overwhelmed by your NCLEX prep? You are not alone, and you do not have to do it alone. We are offering you free 5-day access to our complete NCLEX crash course. No credit card, no catch. Inside, you will find expert-led classes, 5,000 plus high-yield questions, case-based learning, and a study system that finally makes sense. Just tap the WhatsApp link in the description and send "Hi." In less than a minute, you will be inside the course that has helped thousands of students pass with confidence. Ready to trade stress for strategy? Let us jump back into the lesson. Question 16. Let us now focus on surgical wound assessment, a core responsibility in early postoperative care. A nurse is evaluating a client's surgical wound 3 days after surgery. The goal is to determine which findings reflect normal healing versus those that may indicate infection. So, which of the following wound findings would be expected and not a sign of infection? The options are option A, pus or cloudy drainage, option B, mild redness around the incision, option C, increased warmth at the site, and option D, red streaks extending from the wound. The correct answer is option B, mild redness around the incision. Now, here is the rationale. During the early inflammatory phase of wound healing, which typically occurs within the first few days after surgery, it is completely normal for the area around the incision to appear slightly red and inflamed. This reflects increased blood flow and the recruitment of immune cells involved in tissue repair. It is not a sign of infection unless the redness becomes pronounced, widespread, or accompanied by purulent drainage, swelling, or fever. Question 17. Now let us shift to fetal monitoring, a vital component of antepartum care that helps assess fetal well-being in high-risk pregnancies. The nurse is reviewing a client's non-stress test, NST, results during a routine prenatal check. The report indicates a reactive result. Based on this, what is the correct interpretation of the finding? The available options include option A, fetal heart rate accelerations less than 15 beats per minute or lasting less than 15 seconds. Option B, no late decelerations of the fetal heart rate. Option C, late decelerations are present with a minimum of 50% of the contractions. And option D, 2 or more fetal heart rate accelerations within a 20-minute period. The correct answer is option D, 2 or more fetal heart rate accelerations within a 20-minute period. Now, let us look at the rationale. A reactive NST is considered a reassuring sign of fetal health, indicating adequate oxygenation and intact central nervous system function. To meet the criteria for a reactive result, there must be at least 2 fetal heart rate accelerations, each defined as an increase of 15 beats per minute or more above the baseline, lasting at least 15 seconds, all within a 20-minute window. These accelerations typically occur in response to fetal movement and reflect good placental perfusion and neurologic function. Question 18. Let us now move into cardiovascular pharmacology, with a focus on evaluating treatment effectiveness in heart failure management. The nurse is assessing a client with systolic heart failure who is currently receiving carvedilol, a beta blocker. Which of the following findings would best indicate a therapeutic response to the medication? The answer choices are option A, increased urinary output, option B, increased left ventricular ejection fraction, EF, option C, increased left ventricular remodeling, and option D, increased brain natriuretic peptide, BNP. The correct answer is option B, increased left ventricular ejection fraction, EF. Here is the rationale. In systolic heart failure, the heart's ability to eject blood effectively is impaired, leading to reduced cardiac output and symptoms such as fatigue, dyspnea, and fluid retention. Carvedilol is a non-selective beta blocker that works by reducing sympathetic nervous system stimulation, slowing the heart rate, lowering blood pressure, and decreasing myocardial oxygen demand. Over time, it helps to improve ejection fraction, which is a key marker of cardiac performance. Question 19. Switching now to mental health and community resources, let us consider the role of crisis helplines in emergency psychosocial support. Why are these helplines considered such an essential part of crisis intervention systems? The options are: option A, facilitates the ability of the nurse to visit the home. Option B, allows the caller and the call center to plan follow-up care. Option C, serves as a cost-free way to develop new coping strategies. And option D, often saves lives when a person is in a severe crisis. The correct answer is option D, often saves lives when a person is in a severe crisis. Now, for the rationale. Crisis helplines provide immediate, confidential, and free access to trained professionals who can support individuals experiencing acute emotional distress, suicidal ideation, panic attacks, or trauma. These services operate 24/7 and are often the first point of contact for individuals who may not know where else to turn. Crisis counselors are trained to de-escalate intense emotions, assess for safety, and, if necessary, connect the caller to emergency medical or psychiatric resources. The immediacy and accessibility of helplines make them life-saving, particularly in preventing suicide or self-harm. Question 20. Let us now explore a diagnostic tool that plays a key role in confirming heart failure in clients presenting with signs of volume overload or respiratory distress. A client is admitted to the hospital with symptoms suggestive of congestive heart failure. Which laboratory test would most effectively assist the healthcare provider in confirming this diagnosis? The available options are Option A, Basic Metabolic Panel, Option B, B-type natriuretic peptide level, Option C, Comprehensive Metabolic Profile, and Option D, C-reactive protein assay. The correct answer is Option B, B-type natriuretic peptide level. Here is why. B-type natriuretic peptide, BNP, is a hormone released by the ventricles of the heart in response to increased pressure and stretching of the myocardial walls, both of which occur in heart failure. Elevated BNP levels serve as a highly sensitive and specific marker for left ventricular dysfunction and help distinguish cardiac from pulmonary causes of dyspnea. For example, if a client presents with shortness of breath and fluid retention, a BNP value over 100 picograms per milliliter strongly supports the diagnosis of heart failure over conditions like chronic obstructive pulmonary disease or pneumonia. Question 21. Let us now shift to a fundamental skill in nursing assessment: accurate blood pressure measurement. The nurse is checking a client's blood pressure using an automated device, but must decide when it is appropriate to switch to a manual reading. In which of the following situations should the nurse avoid using electronic monitoring and opt instead for manual auscultation? The options include Option A, the client has uncontrollable body tremors. Option B, a central venous catheter is placed in the neck. Option C, the client wears a digital wristwatch on the same arm. And Option D, the client has a functioning cardiac pacemaker. The correct answer is Option A, the client has uncontrollable body tremors. Here is the rationale. Automated blood pressure monitors use oscillometric technology, which detects subtle arterial pulsations to determine systolic and diastolic pressure. However, when a client is experiencing excessive movement, such as coarse tremors from conditions like Parkinson's disease or shivering due to hypothermia, the motion creates artifacts that interfere with the machine's sensors. As a result, the monitor may either fail to register a reading or produce inaccurate results. In such cases, a manual blood pressure measurement using a stethoscope and sphygmomanometer is more reliable. Question 22. Let us now turn our focus to discharge planning for a client facing a life-changing condition: paraplegia due to spinal cord injury. The nurse is preparing for the client's discharge and must determine the most appropriate action to include in the discharge plan. Which of the following is the best intervention at this stage of care? The options are Option A, instruct the client and family to take responsibility for arranging rehabilitation services. Option B, ensure that rehabilitation planning begins early in the client's treatment course. Option C, inform the client to expect minimal short-term rehabilitation before returning to usual activities. And Option D, recommend long-term care placement, as self-care will no longer be possible. The correct answer is Option B, ensure that rehabilitation planning begins early in the client's treatment course. Now let us discuss the rationale. Early rehabilitation planning is a cornerstone of recovery for clients with spinal cord injuries. Once the client is medically stable, the healthcare team must begin laying the foundation for a comprehensive rehabilitation plan, often while the client is still in an acute care setting. This approach not only improves functional outcomes but also supports psychological adjustment by giving the client realistic, goal-oriented milestones. The interdisciplinary team typically includes physical therapy, occupational therapy, social work, case management, and psychological support. Question 23. Now let us move on to a gastrointestinal condition that often requires prompt decompression: paralytic ileus. A client with this diagnosis is scheduled for the insertion of a nasogastric tube, NGT, and the nurse must clearly understand the purpose of this intervention. So, what is the main reason for placing an NGT in a client with paralytic ileus? The options are Option A, to provide enteral feeding. Option B, to relieve stomach distension and remove gastric contents. Option C, to perform gastric irrigation. And option D, to administer medications. The correct answer is option B, to relieve stomach distension and remove gastric contents. Let us break down the rationale. Paralytic ileus is a temporary cessation of intestinal peristalsis, commonly seen after abdominal surgery, electrolyte imbalances, or prolonged opioid use. When peristalsis is impaired, gas, fluids, and gastrointestinal secretions accumulate in the stomach and intestines, leading to bloating, nausea, vomiting, and increased abdominal pressure. The placement of an NGT helps to decompress the gastrointestinal tract, relieve distension, and prevent potential complications like aspiration or bowel perforation. This conservative management supports bowel rest while addressing the symptoms. Question 24. Let us now explore the urgent management of a life-threatening endocrine crisis. Thyroid storm, a severe complication of untreated or poorly managed hyperthyroidism. A client is admitted to the emergency department with symptoms strongly suggestive of this condition. Which of the following medications should the nurse expect the healthcare provider to prescribe to help manage this acute emergency? The available options are option A, enalapril, option B, regular insulin, option C, levothyroxine, and option D, dexamethasone. The correct answer is option D, dexamethasone. Now let us understand why. A thyroid storm presents with dangerously high levels of circulating thyroid hormones, leading to fever, tachycardia, agitation, hypertension, and cardiac arrhythmias. Immediate treatment is aimed at suppressing hormone activity and stabilizing vital functions. Dexamethasone, a corticosteroid, plays a crucial role by inhibiting the peripheral conversion of thyroxine, T4, into the more active triiodothyronine, T3. This helps blunt the excessive hormonal effect on tissues and rapidly improves clinical stability. Additionally, corticosteroids like dexamethasone help control the inflammatory stress response, which is often heightened during a thyroid storm. Question 25. Now, let us examine an emergency pharmacologic intervention that can make the difference between life and death in opioid toxicity. The nurse is caring for a client in the emergency department who is exhibiting signs of a suspected morphine overdose, including respiratory depression, pinpoint pupils, and decreased responsiveness. In this urgent scenario, which medication should the nurse prepare to administer to counteract the effects of the opioid? The options are option A, sodium bicarbonate, option B, flumazenil, option C, diphenhydramine, and option D, naloxone. The correct answer is option D, naloxone. Here is the rationale. Naloxone is the antidote of choice in opioid overdose situations. It works as a competitive opioid receptor antagonist, rapidly displacing morphine or other opioids from the mu receptors in the central nervous system. This reversal effect restores respiratory drive, improves consciousness, and stabilizes vital signs. Naloxone can be administered via intravenous, intramuscular, or intranasal routes, and typically shows results within 1 to 2 minutes of administration. However, its short half-life means that multiple doses may be necessary, especially in overdoses involving long-acting opioids. Let us be honest, NCLEX prep can feel like too much sometimes. But imagine having every tool you need right in your pocket. That is exactly what you get with our free 5-day trial of the complete NCLEX crash course. From live coaching to downloadable PDFs, clinical case walkthroughs, and 5,000+ real exam questions, you will have everything top scorers use. No sign-up hassles, just click the WhatsApp link below and message "Hi" to get started. It is fast, it is free, and it works. Let us get back to the questions. You are crushing this. Question 26. Shifting our focus to workplace safety, let us now consider a vital aspect of healthcare operations: facility security. In order to ensure a secure environment for both clients and staff, which of the following statements best reflects a key principle of maintaining security in a healthcare setting? The available choices include option A, only client room doors are exempt from needing egress alarms in healthcare facilities. Option B, every healthcare worker, regardless of role, must receive training related to facility security. Option C, security training is only necessary for staff involved in direct patient care. And option D, staff in administrative roles are exempt from mandatory security education. The correct answer is option B, every healthcare worker, regardless of role, must receive training related to facility security. Now, here's the rationale. Healthcare security is not limited to one department. It is a shared responsibility across the entire organization. Threats such as workplace violence, unauthorized access, infant abduction, and emergency lockdowns require every employee to be aware of policies, alert systems, and appropriate actions. Whether someone works in clinical care, food services, environmental support, or administration, all staff must be trained to identify risks and respond accordingly. See the question 27. A nurse is evaluating a client for possible Raynaud disease. Which of the following clinical signs is most consistent with this diagnosis? A. Swelling in only one lower extremity. B. Episodes of painful color changes in the fingers. C. Audible cracking or popping sounds in joints. D. Cramping leg pain that resolves with rest. The correct answer. IA, B, C the rationale. Choice. B is correct. Because Raynaud phenomenon is a vascular condition that leads to transient, painful vasospasms of the small arteries, particularly in the fingers and toes. These spasms are triggered by cold exposure or emotional stress, resulting in a triphasic color change: white, ischemia; blue, cyanosis; and red, reperfusion. The condition is often linked to autoimmune diseases like systemic lupus erythematosus or scleroderma. Question 28. Let us now explore a routine yet essential aspect of initial prenatal care: screening for sexually transmitted infections that can affect both mother and fetus. The nurse is preparing to collect a blood sample from a pregnant client during her first prenatal visit. Which test would be the most appropriate for screening syphilis? The options are: Option A, brain natriuretic peptide, BNP. Option B, comprehensive metabolic panel, CMP. Option C, complete blood count, CBC. And option D, rapid plasma reaction, RPR. The correct answer is option D, rapid plasma reaction, RPR. Now, here is the rationale. The RPR test is a non-treponemal blood test that detects antibodies produced in response to cellular damage caused by the syphilis organism. It is widely used during early prenatal care because early diagnosis and treatment of syphilis with intramuscular penicillin G can prevent devastating fetal complications like stillbirth, congenital anomalies, or miscarriage. If positive, the RPR result is usually confirmed with a fluorescent treponemal antibody absorption, FT-AABS test. Question 29. Next, let us consider a common but often overlooked emergency in geriatric nursing: sudden confusion in an older adult receiving home health care. The nurse arrives for a scheduled visit and notices that the client has suddenly become disoriented. What is the first thing the nurse should assess? The options are: Option A, drug intoxication; Option B, increased hearing loss; Option C, cancer metastases; and Option D, congestive heart failure. The correct answer is Option A, drug intoxication. Here is the rationale. In elderly clients, acute confusion or delirium is most often related to medication side effects or interactions, especially due to polypharmacy. Age-related changes in renal and hepatic function slow drug clearance, leading to increased sensitivity to medications like benzodiazepines, opioids, anticholinergics, and even over-the-counter drugs. This makes medication review a top priority. Question 30. Now shifting to a psychiatric care setting, let us consider pre-procedure medication management for a client scheduled for electroconvulsive therapy, ECT. The nurse is reviewing the client's medication list. Which medication, if continued, could interfere with the effectiveness of the therapy? The options are: Option A, citalopram; Option B, pantoprazole; Option C, phenytoin; and Option D, risperidone. The correct answer is Option C, phenytoin. Let us explore why. Phenytoin is an anticonvulsant used to control seizures. However, during ECT, the goal is to induce a therapeutic seizure, and medications that raise the seizure threshold, like phenytoin, can reduce the treatment's effectiveness. The presence of phenytoin in the client system may prevent the necessary seizure activity, undermining the entire therapeutic objective. Question 31. Now let us review a medication often administered for volume expansion, intravenous albumin. The nurse is providing discharge education to a client who recently received albumin for hypoalbuminemia. What is the primary therapeutic effect of this medication that the nurse should explain? The choices are: Option A, stimulating the bone marrow to produce red blood cells. Option B, increasing the liver's production of clotting factors. Option C, enhancing oncotic pressure within the vascular system. And option D, suppressing inflammatory cytokine release throughout the body. The correct answer is option C, enhancing oncotic pressure within the vascular system. Here is the rationale. Albumin is a natural colloid and the most abundant plasma protein responsible for maintaining oncotic pressure, the force that helps keep fluid within the intravascular space. In clients with low albumin levels, such as those with liver disease or malnutrition, fluid tends to leak into the interstitial tissues, causing edema and hypotension. Administering albumin draws fluid back into the bloodstream, helping to restore blood pressure and circulatory volume. Question 32. Let us begin with a common pediatric scenario involving acute otitis media, AOM, a painful condition frequently seen in infants and toddlers. A nurse is caring for a 1-year-old child diagnosed with AOM who has been febrile for the past 24 hours, is pulling at the left ear, and showing signs of otalgia or ear pain. In this case, what should be the priority nursing action? The available options are: Option A, position the child on the left side. Option B, administer antibiotic ear drops. Option C, administer acetaminophen as prescribed. And option D, apply a warm compress to the left ear. The correct answer is option C, administer acetaminophen as prescribed. Here is why. In the acute phase of otitis media, managing the child's pain and fever is the most immediate concern. Acetaminophen serves a dual purpose. It acts as an antipyretic to reduce fever and as an analgesic to relieve pain, improving the child's comfort while antibiotics begin to work. Question 33. Now, let us shift to a gastrointestinal emergency in pediatric care. Celiac crisis. The nurse is caring for a child in the emergency department who is experiencing this rare but severe complication of celiac disease. Which intervention should the nurse anticipate as the first priority? The options include Option A, tap water enema. Option B, intravenous fluid replacement. Option C, fluid restriction. And Option D, nasogastric tube, NGT, insertion. The correct answer is Option B, intravenous fluid replacement. The rationale is that a celiac crisis presents with profuse diarrhea, severe dehydration, and electrolyte imbalances, which can quickly lead to hypovolemic shock if not treated. Rapid and aggressive IV fluid administration is critical to restore circulatory volume and stabilize hemodynamics. Question 34. Let us now highlight a common misconception about hospice care in palliative nursing. During a staff education session, the nurse is teaching about the nature of hospice services. Which statement should be included in this teaching? The options are: Option A, hospice is designed to help manage symptoms related to sudden acute illnesses. Option B, hospice care only involves pain relief and basic comfort measures. Option C, the main focus is to continue curative treatments to reverse disease. And Option D, hospice services can be provided in both home-based and inpatient settings. The correct answer is Option D, hospice services can be provided in both home-based and inpatient settings. Hospice care is meant for clients with a life expectancy of 6 months or less and focuses on comfort, quality of life, and support rather than curative treatment. It can be administered in the home, nursing homes, or inpatient hospice units based on the client's needs. Question 35. Next, let us explore a critical vascular access procedure, removing an internal jugular central venous catheter. The nurse must choose the safest position for the client during this process. Which position is most appropriate? The choices are Option A, reverse Trendelenburg, Option B, left lateral, Option C, Trendelenburg, and Option D, high Fowler's. The correct answer is Option C, Trendelenburg. This position increases intrathoracic pressure, which helps prevent air embolism during catheter removal. It is often combined with asking the client to hold their breath or perform the Valsalva maneuver, further decreasing the risk of air entering the central venous system. Hey, future RN, if this lecture is helping you, imagine what a full crash course could do. You can now grab free 5-day access to our complete NCLEX crash course, packed with live and recorded classes, 5,000 plus practice questions, and full case walkthroughs that actually make sense. No commitments, no payment, just real tools that work. Click the WhatsApp link in the description and send hi to unlock it all. We will get you set up in seconds. All right, back to the lesson, because you are doing amazing, and we are here to help every step of the way. Question 36. Let us now turn to a common concern in geriatric nursing, changes in cognition. The nurse is assessing cognitive decline in an older adult. Which of the following conditions is the most common cause of cognitive impairment in the elderly? The options are Option A, stroke, Option B, malnutrition, Option C, Alzheimer's disease, and Option D, reduced cardiac reserve. The correct answer is Option C, Alzheimer's disease. This progressive neurodegenerative disorder is the leading cause of dementia in older adults, characterized by memory loss, disorientation, personality changes, and eventual loss of independence. It is caused by abnormal accumulation of beta-amyloid plaques and neurofibrillary tangles in the brain. Move to question 37. A nurse is caring for a client with a newly placed tracheostomy who suddenly becomes dyspneic and is coughing forcefully. Upon assessment, the nurse notes the tracheostomy tube has dislodged. What is the nurse's first action? The options are A, call the rapid response team, B, cover the tracheostomy site with a sterile dressing seat, attempt to reinsert the tracheostomy tube using a curved hemostat, D, administer oxygen via face mask over the stoma. The correct answer is C, because when a fresh tracheostomy becomes dislodged within the first 7 days, the nurse's priority is to maintain airway patency. Reinserting the tracheostomy tube immediately is the safest action and may prevent respiratory arrest. Using a curved hemostat or obturator helps guide the tube gently back into place. Calling for help is important, but not the first action. Covering the stoma or applying a face mask without securing the airway may worsen oxygenation. Now switching our attention to question 38A, client with schizophrenia tells the nurse, the television is talking to me and sending me secret messages. What is the best response by the nurse? Options are A, that is not true. The television cannot talk to you. B, what is the television saying to you? C, you are just imagining things because of your illness. D, why do you think the television is doing that? Correct answer is B. What is the television saying to you? Because this response demonstrates therapeutic communication by exploring the client's experience without reinforcing the delusion. Asking what the client hears allows the nurse to assess for potential risk while maintaining a non-judgmental tone. Questions 39. A terminally ill client decides to discontinue chemotherapy despite the family's objections. What is the nurse's best response? Option choices are A, notify the provider to override the client's decision. B, explain to the client why the treatment should continue. C, support the client's decision and advocate for autonomy. D, encourage the family to persuade the client to continue. Correct answer is C. C, the rational. Autonomy is a fundamental ethical principle that respects a client's right to make informed decisions about their own care, even if others disagree. The nurse should support the client's choice and communicate it clearly to the healthcare team. Overriding the client or pressuring them violates ethical standards. The nurse serves as a client advocate in such emotionally charged situation. Question 40. A nurse is caring for 4 clients. Which client should the nurse assess first? The options are A, a client with asthma who has a peak flow reading at 85% of personal best. B, a client newly diagnosed with diabetes asking how to use an insulin pen. C, a client with a chest tube who reports bubbling in the water seal chamber. D, a client with pneumonia who is restless and has a respiratory rate of 32 breaths per minute. The correct answer is D, a client with pneumonia who is restless and has a respiratory rate of 32 breaths per minute. This client is showing signs of acute respiratory distress. Restlessness and tachypnea may indicate hypoxia or impending respiratory failure. According to the NCLEX principle of airway, breathing, and circulation, this client should be assessed first. The client with asthma is stable with a good peak flow reading. The diabetes education can wait until after critical needs are met. Bubbling in the water seal chamber may be expected depending on the phase of respiration and does not take priority over respiratory distress. Question 41. Let us now explore a reassuring moment many expectant mothers experience during mid-pregnancy. The first awareness of fetal movement. A pregnant client at 19 weeks gestation calls the antepartum clinic and shares that she feels a fluttering sensation in her lower abdomen. Which explanation by the nurse would be the most appropriate to address this report? The available responses include Option A, you are likely experiencing quickening. Option B, this sensation means the baby has dropped lower into your pelvis. Option C, that fluttering is probably due to a reflex felt during a vaginal examination. And Option D, these feelings may reflect mixed emotions about the pregnancy. The correct answer is Option A, you are likely experiencing quickening. Now, let us review why. Quickening refers to the mother's first perception of fetal movement, commonly described as fluttering, bubbling, or rolling sensations in the lower abdomen. It typically occurs between 16 and 20 weeks of gestation, especially for first-time mothers, and is considered a normal and reassuring sign of fetal activity. Question 42. Shifting now to emergency response, let us look at the essential initial interventions for anaphylactic shock. A nurse is teaching an in-service session about emergency care for anaphylaxis and asks the group to identify what should be done immediately after intravenous access is established. Which response is most appropriate? The options are Option A, begin infusion of 0.9% sodium chloride solution. Option B, administer diphenhydramine through the intravenous line. Option C, instruct the client to carry pre-filled hydrocortisone injections. And Option D, place the client in reverse Trendelenburg if hypotension develops. The correct answer is Option A, begin infusion of 0.9% sodium chloride solution. Here is the rationale. In anaphylactic shock, the body experiences widespread vasodilation and capillary leakage, leading to rapid intravascular fluid loss and hypotension. A rapid infusion of isotonic fluids such as normal saline is necessary to restore circulating volume and maintain blood pressure, while other treatments like intramuscular epinephrine are administered. Question 43. Let us now focus on providing emotional support to caregivers of clients with Alzheimer's disease, a condition known for profound memory loss. A family member says to the nurse, I am so tired of hearing Dad talk about things that happened 30 years ago. Which response from the nurse would be most appropriate? The options include Option A, try to be more patient and accepting of your father's condition. Option B, it may help to redirect the conversation to more current topics. Option C, your father is experiencing short-term memory loss, but he may still recall long past events. And Option D, reminding him about his repetition might help him recognize and correct it. The correct answer is Option C, your father is experiencing short-term memory loss, but he may still recall long past events. Now, here is the rationale. In the early and middle stages of Alzheimer's disease, short-term memory is affected first, while long-term memories, especially from decades ago, may remain relatively intact. This phenomenon often leads clients to frequently revisit and talk about distant memories, which can offer a sense of identity, stability, and comfort. Question 44. Let us now consider the critical issue of early signs of worsening respiratory distress in children. The nurse is caring for a pediatric client diagnosed with croup, a viral illness affecting the upper airway. Which clinical sign should prompt the most immediate action by the nurse? The options include Option A, barking cough, Option B, hoarseness, Option C, inspiratory stridor at rest, and Option D, low-grade fever. The correct answer is Option C, inspiratory stridor at rest. Here is the rationale. While a barking cough and hoarseness are typical early features of croup, stridor heard at rest signifies upper airway narrowing and potential impending airway obstruction, which can escalate quickly. This finding indicates the need for prompt intervention, which may include humidified oxygen, corticosteroids, or racemic epinephrine to prevent respiratory failure. Question 45. Now turning to psychiatric nursing, let us address the correct terminology for documenting fixed false beliefs. A client states, "You people are working for the government and plotting to destroy me." How should the nurse best describe this behavior in the medical record? The answer choices include Option A, delusion of grandeur, Option B, somatic delusion, Option C, delusion of persecution, and Option D, delusion of reference. The correct answer is Option C, delusion of persecution. This type of delusion involves the unfounded belief that others are intentionally trying to harm, harass, or conspire against the individual. The client's statement reflects paranoia and a belief of targeted oppression, which are classic features of persecutory delusions. Hold up, before we dive deeper, here's a quick opportunity you do not want to miss. If you are serious about passing the NCLEX on your first try, our free 5-day access to the complete NCLEX crash course is your golden ticket. You will get expert-led sessions, over 5,000 NCLEX-style questions, case studies, priority setting strategies, and downloadable guides, all designed to give you real exam confidence. And the best part? No credit card required. Just click the WhatsApp link in the description and say, "Hi," to get started. Thousands of future nurses are already leveling up. Do not be the one left behind. Now, let us jump back into the lecture. Question 46. Now, let us focus on professional communication in the workplace. During a busy shift, a nurse notices that an unlicensed assistive personnel, UAP, has walked past several activated call lights without responding. What is the most appropriate initial response by the nurse? The options are: Option A, speak directly to the UAP about the observed behavior. Option B, notify the charge nurse of the unsafe behavior. Option C, submit an incident report to document the safety concern. And Option D, ask another UAP to take over the original UAP's assignments. The correct answer is Option A, speak directly to the UAP about the observed behavior. Open and respectful communication allows the nurse to clarify expectations and determine whether the UAP is overwhelmed, unaware, or in need of redirection. Question 47. Let us now review safe application of cold therapy, a common non-pharmacologic intervention for injuries like sprains. A nurse is applying a cold compress to a client's sprained ankle. What is the maximum recommended time the compress should be left in place to avoid tissue damage? The options are: Option A, 20 minutes, Option B, 10 minutes, Option C, 30 minutes, and Option D, 15 minutes. The correct answer is Option A, 20 minutes. Cold application causes vasoconstriction, which helps reduce pain, swelling, and inflammation. However, if left on for more than 20 minutes, the body may experience a rebound vasodilation effect, also known as the hunting response, which could actually worsen swelling. Question 48. Now, let us consider conditions that impair wound healing, especially after surgery. The nurse is discussing complications of delayed wound healing with a colleague. Which of the following conditions contributes most directly to this risk? The answer choices are: Option A, diabetes insipidus, Option B, Cushing's syndrome, Option C, hemophilia, and Option D, inflammatory bowel disease. The correct answer is Option B, Cushing's syndrome. This endocrine disorder results from excess corticosteroids, either endogenous or exogenous, which lead to immune suppression, hyperglycemia, and protein catabolism, all of which impair cellular repair, immune response, and collagen synthesis necessary for wound healing. Question 49. Let us now shift to emergency blood transfusion compatibility. A client with blood type A positive urgently needs a transfusion, but the only available unit in the blood bank is type O positive. What should the nurse do first? The options are: Option A, arrange for a cross-match between the available blood and the client's blood. Option B, call the other blood banks and ask if they have blood units available with the client's blood type. Option C, notify the physician that there is no available blood in the blood bank. And Option D, call the client's family and tell them that he needs blood. The correct answer is Option A, arrange for a cross-match between the available blood and the client's blood. While O-positive blood can be given to A-positive clients, it is still essential to cross-match for compatibility to avoid hemolytic transfusion reactions. This is a life-saving yet safety-critical step in emergency transfusion practice. Question 50. Let us now look at a developmental milestone question that often arises in pediatric well-child visits. A mother of a 2-year-old child shares a concern that her son prefers to play alone while his cousins interact and play together. What is the best response by the nurse to reassure the parent appropriately? The answer choices include Option A, your child is a toddler. It's normal for his age to just play all by himself while other children play too. Option B, did you encourage him to play with the other children? Maybe you don't encourage him, that's why he doesn't play with them. Option C, let's mention that to the doctor when he comes in to see him. And Option D, I really recommend your child be checked by a child psychologist. The correct answer is Option A. At this age, children typically engage in parallel play, which means playing alongside others without direct interaction. This behavior is a normal and expected developmental stage and does not suggest any underlying concern. Question 51. Let us now review a simple yet essential tool used in visual assessment. The nurse is evaluating a client's distance visual acuity. Which instrument is most appropriate for this examination? The options include Option A, Snellen chart, Option B, tonometer device, option C, pen light, and option D, slit lamp. The correct answer is option A, Snellen chart. This chart is the standard tool used to assess how clearly a person can see at a distance, typically 20 feet away. It helps identify visual deficits such as myopia or astigmatism. Question 52. Now shifting to a legal and ethical situation in mental health care, the nurse is preparing a client for electroconvulsive therapy, ECT, who has been involuntarily admitted. The nurse notes that the consent form is unsigned. What should the nurse understand in this scenario? See the options. A. The court automatically provides consent for all procedures involving involuntarily admitted clients. B. Informed consent should be obtained from the client. C. The client's spouse may provide consent in this situation. D. Consent is not required for electroconvulsive therapy in involuntarily admitted clients. The answer is, informed consent should be obtained from the client. Even though the client is involuntarily admitted, this does not eliminate their right to autonomy or the ability to make informed decisions about their treatment. Unless the court has deemed the client legally incompetent, the client must be the one to provide or withhold consent for ECT. A spouse cannot legally consent unless they are the designated healthcare proxy or guardian. ECT is an invasive procedure requiring voluntary consent, and skipping this step would be a violation of both ethical and legal standards. In summary, the nurse must ensure that informed consent is obtained directly from the client unless a court has ruled otherwise. Question 53. Let us now apply a medication math calculation in a clinical scenario. A provider prescribes 100 milliliters of 0.9% sodium chloride to be infused over 2 hours using microdrip intravenous tubing. What is the correct flow rate in drops per minute? To solve this, we use the formula. Flow rate equals volume multiplied by drop factor, divided by time in minutes. Here, the volume is 100 milliliters. The drop factor for microdrip tubing is 60 drops per milliliter, and the time is 2 hours, which is equal to 120 minutes. So, 100 multiplied by 60 equals 6,000, and 6,000 divided by 120 equals 50 drops per minute. This is the rate the nurse should set on the intravenous tubing to ensure accurate and safe medication administration. Accurate dosage calculation is critical in preventing complications, especially with medications that have a narrow therapeutic range or when maintaining fluid balance is essential. Question 54. Finally, let us review a client education scenario involving glaucoma management. The nurse is teaching a client about medications to avoid. Which drug class is contraindicated in clients with glaucoma due to its effect on intraocular pressure? The answer choices are option A, beta blockers, option B, osmotic diuretics, option C, anticholinergics, and option D, alpha-2 adrenergic agonists. The correct answer is option C, anticholinergics. These medications, such as atropine or scopolamine, can cause pupil dilation and reduce aqueous humor outflow, leading to a dangerous rise in intraocular pressure. This can worsen glaucoma and increase the risk of optic nerve damage. In contrast, beta blockers and alpha-2 adrenergic agonists are commonly used to reduce aqueous humor production, helping to control intraocular pressure. Osmotic diuretics like mannitol are used in emergencies to rapidly lower pressure, especially in acute angle closure glaucoma. In summary, clients with glaucoma should avoid anticholinergic medications, and nurses must always verify prescriptions for safety in ocular conditions. Question 55. Now let us consider a scenario involving dietary guidance for chronic gastrointestinal symptoms. A 25-year-old client reports bloating, flatulence, and intermittent abdominal pain that has persisted for several months. Which of the following foods should the nurse recommend the client avoid to reduce these symptoms? The options are option A, foods high in fiber, option B, broccoli, option C, yogurt, and option D, simple carbohydrates. The correct answer is option B, broccoli. Here is the rationale. Broccoli belongs to the cruciferous vegetable group, which includes cabbage, Brussels sprouts, and cauliflower. These vegetables are known to cause gas production during digestion due to their fiber and sulfur content. In clients with sensitive digestive systems, broccoli can worsen bloating and abdominal discomfort. Hold up. What if I told you there is a shortcut to mastering the NCLEX? For a limited time, you can access our complete NCLEX crash course for absolutely free for 5 days. That is thousands of exam-style questions, clinical simulations, bite-sized video reviews, and guided study plans, all without paying a single rupee. All you have to do is click the WhatsApp link in the description and say, "Hi." We will unlock your access instantly, no strings attached. This is your shortcut. Use it. Now, back to your lecture. Let us keep leveling up. Question 56. Let us now shift to preoperative education for a client scheduled for a pneumonectomy, the surgical removal of a lung. During teaching, the client asks what to expect after surgery. Which of the following statements should the nurse include? The choices are: Option A, after the surgery, you should lie on the non-operative side. Option B, your breathing will return to normal within a few hours. Option C, you should avoid coughing since suctioning will be done for you. And Option D, you will be encouraged to start walking the same day as your surgery. The correct answer is Option D. You will be encouraged to start walking the same day as your surgery. Let us explore why. Early ambulation, often within 8 hours post-operatively, is crucial in reducing the risk of pneumonia, atelectasis, and thromboembolism. Movement promotes lung expansion in the remaining lung and supports circulation, making it a critical component of recovery. Question 57. Now let us review correct client positioning for a diagnostic procedure. The nurse is preparing a client for a liver biopsy and must position the client properly to allow safe and effective access. Which position is most appropriate during the procedure? The answer choices are: Option A, prone with both arms extended overhead. Option B, supine with the right arm extended outward and head turned to the left. Option C, left lateral with the right arm raised above the head. And Option D, Trendelenburg's position with the head lowered and legs elevated. The correct answer is Option B, supine with the right arm extended outward and head turned to the left. This positioning exposes the right upper quadrant, particularly the right costal margin, where the liver biopsy needle is inserted. Turning the head away from the site improves access and visualization while keeping the airway clear. Question 58. Let us now consider psychosocial development in early childhood. Guided by Erickson's stages of development, a nurse is developing a care plan for a 4-year-old child. According to Erickson's theory, which psychosocial stage is the child currently navigating? The choices are: Option A, initiative versus guilt. Option B, autonomy versus shame and doubt. Option C, industry versus inferiority. And Option D, trust versus mistrust. The correct answer is Option A, initiative versus guilt. This stage applies to preschool-aged children, 3 to 5 years old, who begin asserting themselves through exploration and independent play. Successfully navigating this stage fosters a sense of confidence, purpose, and leadership. When children are overly controlled or frequently criticized, they may develop feelings of guilt about their desires and curiosity. Question 59. Finally, let us address a situation involving parenteral nutrition and infusion timing. A nurse is caring for a client receiving total parenteral nutrition, TPN, along with intravenous fat emulsions. The nurse notices that the fat emulsion infusion is running 1 hour behind schedule. What is the most appropriate nursing action? The answer choices are: Option A, increase the infusion rate temporarily to catch up, then return to the prescribed rate. Option B, raise the rate to ensure the infusion finishes on time. Option C, check that the infusion is running at the prescribed rate and continue it as ordered. And Option D, discontinue the infusion and notify the provider. The correct answer is Option C, check that the infusion is running at the prescribed rate and continue it as ordered. Fat emulsions are infused slowly over a specific time frame to prevent complications such as fat overload syndrome, which can result in respiratory distress and pancreatitis. The nurse must not increase the rate to compensate for a delay, as rapid infusion increases the risk of metabolic disturbances. Question 60. Let us now examine respiratory assessment in the context of a vulnerable population: older adults with pneumonia. A 76-year-old client has been admitted with a diagnosis of pneumonia. Among several initial assessments, which should be the nurse's top priority? The options include Option A, airway patency. Option B, percussion over the lung fields. Option C, auscultation of breath sounds. And Option D, monitoring respiratory rate. The correct answer is Option A, airway patency. Here is the rationale. In elderly clients, pneumonia can severely compromise respiratory function due to weakened respiratory muscles, a diminished cough reflex, and reduced lung expansion. Ensuring that the airway is open and unobstructed is fundamental, as it allows effective oxygen exchange and reduces the risk of hypoxia, hypercapnia, and respiratory acidosis. Question 61. Now let us shift to an acute abdominal emergency, pancreatitis, where early intervention is key to preventing systemic complications. A client has been admitted to the emergency department with a diagnosis of acute pancreatitis. Which intervention should the nurse prioritize obtaining a prescription for? The options are Option A, initiation of intravenous fluid therapy. Option B, administration of ondansetron. Option C, insertion of a nasogastric tube. And Option D, fentanyl via patient-controlled analgesia, PCA. The correct answer is Option A, initiation of intravenous fluid therapy. Here is the rationale. In acute pancreatitis, fluid shifts into the retroperitoneal space can lead to hypovolemia, hypotension, and shock. Early and aggressive isotonic fluid resuscitation, e.g. normal saline or lactated ringers, is critical for maintaining organ perfusion, particularly to the pancreas and kidneys. Question 62. Let us now focus on psychopharmacology education for clients newly prescribed anxiolytics. A nurse is teaching a client who has been started on buspirone for generalized anxiety disorder. Which of the following client statements would indicate the need for further teaching? The options are Option A, it might take a few weeks before I start feeling better. Option B, I can take it with or without food as long as I am consistent. Option C, I should only take this medicine when my anxiety becomes severe. And Option D, I might feel a bit nauseous when I take this. The correct answer is Option C, I should only take this medicine when my anxiety becomes severe. Here is the rationale. This statement reveals a misunderstanding of how buspirone works. Unlike benzodiazepines, which are taken as needed for acute anxiety, buspirone must be taken on a scheduled basis, typically 2 to 3 times daily, for consistent blood levels. It works gradually, with full therapeutic effects emerging after 2 to 4 weeks. Question 63. Now, turning to pharmacology, let us examine the rationale behind prescribing cimetidine. A nurse is reviewing a new prescription for cimetidine for a hospitalized client. The nurse recognizes that this medication is primarily prescribed for which of the following conditions? The options are Option A, cystic fibrosis, Option B, Clostridium difficile infection, Option C, Helicobacter pylori infection, and Option D, Crohn's disease. The correct answer is Option C, Helicobacter pylori infection. Cimetidine is a histamine 2 receptor antagonist that decreases stomach acid secretion by blocking histamine at the H2 receptors of gastric parietal cells. It is commonly used to treat peptic ulcers and gastroesophageal reflux disease. In the context of Helicobacter pylori infection, cimetidine is used alongside antibiotics, such as amoxicillin or metronidazole, to promote ulcer healing by reducing the acidic environment that H. pylori thrives in. Question 64. Next, let us explore a non-pharmacologic approach to managing pain through sensory modulation. Which of the following clients would most likely benefit from contralateral stimulation as a non-pharmacological comfort intervention? The options are Option A, a 36-year-old client with abdominal pain. Option B, a 56-year-old client with a below-the-knee amputation and phantom limb pain. Option C, a 76-year-old client with terminal cancer. And Option D, an 84-year-old client with severe arthritis. The correct answer is Option B, a 56-year-old client with phantom limb pain. Contralateral stimulation involves applying massage, vibration, or pressure to the opposite side of the body to relieve pain that originates from an area that is inaccessible, such as a missing limb. This technique utilizes the brain's somatosensory overlap and can modulate pain signals by stimulating corresponding nerve pathways. Question 65. Now shifting to physical assessment, let us review the correct technique for evaluating abdominal complaints. A nurse is caring for a client who reports abdominal pain. When performing the abdominal assessment, what should the nurse do first after inspection? The options include Option A, auscultate for bowel sounds. Option B, palpate the painful area first. Option C, palpate to detect masses or fluid. And Option D, percuss for organ enlargement. The correct answer is Option A, auscultate for bowel sounds after inspecting the abdomen. The correct sequence for an abdominal exam is inspection, auscultation, percussion, and palpation. Auscultation must occur before palpation or percussion, as touching the abdomen can stimulate peristalsis and falsely alter bowel sound frequency. Quick pause. If you are watching this, it means you are serious about passing. So why not fast-track your success? We are giving away free 5-day access to our complete NCLEX crash course. No payment needed. You will unlock targeted reviews, daily study plans, 5,000 plus NCLEX level questions, and high-yield case studies, all taught by experts who know exactly what the exam is testing. Just hit the WhatsApp link in the description, send hi, and boom, you are in. Take advantage while it is still available. Let us get back to it. You are on fire. Question 66. Let us now consider a post-operative emergency scenario in the post-anesthesia care unit, PACU. The nurse is assessing a client who has just undergone an appendectomy. Which finding requires immediate follow-up? The options are Option A, breath sounds that are high-pitched and crowing. Option B, incisional pain rated 5 out of 10. Option C, capillary blood glucose of 115 milligrams per deciliter. And Option D, persistent nausea after antiemetic administration. The correct answer is Option A, high-pitched crowing breath sounds. These sounds, also known as stridor, indicate a potential upper airway obstruction, which may be caused by laryngeal edema, laryngospasm, or anaphylaxis. Stridor is a medical emergency because it signals impending airway compromise, especially dangerous in the post-operative period when residual sedation, swelling, or medication reactions can worsen respiratory status. The nurse should immediately notify the provider and prepare for interventions such as oxygen, epinephrine, or possible reintubation. Question 67. Let us begin with a practical dosage calculation involving oral suspension. A nurse is preparing to administer 100 milligrams of amoxicillin by mouth 4 times daily. The available supply is labeled as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer per dose? To solve this, we apply the standard formula. Desired dose divided by available dose, multiplied by volume, equals the dose to give. Substituting the values, 100 divided by 250 multiplied by 5 equals 0.4 multiplied by 5, which equals 2 milliliters per dose. This means the nurse will administer 2 milliliters 4 times a day, totaling 8 milliliters per day. This calculation ensures accurate and safe drug delivery, which is particularly critical when administering pediatric medications like antibiotics. Question 69. Let us now consider a safety scenario involving sensory impairments. A nurse is admitting a client who is both blind and deaf. Which nursing action should be prioritized to ensure the client's immediate safety and comfort? See which options will suggest best response. A. Review the plan of care with the client. B. Communicate any safety concerns to the nursing supervisor. C. Update the client on available social activities. D. Create and maintain a safe environment for the client. The correct response is Option D. Create and maintain a safe environment for the client. Clients with dual sensory impairments are at high risk for disorientation, injury, and falls, especially in unfamiliar settings. The nurse must ensure that the client's surroundings are hazard-free. This includes orienting the client to their space, keeping essential items within reach, and offering consistent physical cues or tactile communication tools. Question 70. Shifting now to complications of intravenous therapy, let us review the concept of infiltration. During a teaching session, a nurse asks students to define this complication. See the choices. A. A non-vesicant drug unintentionally enters the subcutaneous tissue. B. A vesicant drug accidentally leaks into the subcutaneous tissue. C. A vesicant drug is injected directly into the muscle. D. A vesicant drug leaks into the intradermal tissue. The best response is Option A. A non-vesicant drug unintentionally enters the subcutaneous tissue. Infiltration occurs when a solution like normal saline leaks from the vein into surrounding tissue due to catheter dislodgement or vein rupture. It may cause swelling, coolness, and discomfort, but typically resolves without permanent damage. Question 71. Now let us focus on medication safety with aspirin. The nurse is caring for a client receiving prescribed aspirin. Which of the following findings should raise concern about a potential adverse effect? See the options. A. Increased urination. B. Low potassium levels. C. Development of a venous thromboembolism. D. Presence of black tarry stools. The correct answer is Option D. Presence of black tarry stools. This symptom suggests upper gastrointestinal bleeding, a known risk with aspirin due to its antiplatelet and mucosal irritating properties. This side effect demands prompt action to prevent severe blood loss or anemia. We turn to non-pharmacologic anxiety management in a pediatric setting. A 12-year-old with chronic asthma is learning to use guided imagery to cope with anxiety. Which client statement best reflects correct understanding? Let's have a look on options. A. I can do this anytime and anywhere when I feel anxious. B. I must be lying down to practice guided imagery. C. My mom has to be there whenever I do it. D. I have to play music every time for it to work. The correct answer is option A. I can do this anytime and anywhere when I feel anxious. Guided imagery is a flexible technique that involves visualizing calming scenes or sensations, and it does not require special equipment or a specific setting. Question 73. Finally, let us address a high-risk situation in psychiatric nursing triage. A nurse is handling phone calls at a mental health clinic. Which report requires the most urgent follow-up? See the options. A. A client taking olanzapine who reports muscle stiffness and feeling hot. B. A client taking haloperidol who reports blurred vision and constipation. C. A client taking clozapine who reports occasional mouth twitches. D. A client taking aripiprazole who reports feeling very restless. The correct answer is option A. A client taking olanzapine who reports muscle stiffness and feeling hot. This constellation of symptoms suggests neuroleptic malignant syndrome, NMS, a rare but life-threatening adverse reaction to antipsychotics like olanzapine. Early symptoms include hyperthermia, rigidity, altered mental status, and autonomic instability. This client must be seen immediately for discontinuation of the drug and medical management. Question 74. Let us begin with a critical emergency condition involving muscle breakdown. A nurse is caring for a client who presents to the emergency department with suspected rhabdomyolysis. Which initial intervention should the nurse anticipate implementing? Here are their options. Administering intravenous fluids. B. Monitoring liver enzyme levels. C. Administering corticosteroids. D. Initiating prophylactic antibiotic therapy. The correct answer is option A. Administering intravenous fluids. Rhabdomyolysis results from skeletal muscle breakdown, which releases myoglobin, potassium, and creatine kinase into the bloodstream. The most immediate threat is acute kidney injury due to the nephrotoxic effect of myoglobin. Therefore, aggressive hydration with isotonic intravenous fluids is the first-line intervention to dilute myoglobin, maintain renal perfusion, and promote diuresis, ideally even before laboratory confirmation. Question 75. Shifting our focus to infectious cardiac conditions, let us consider a client newly admitted with infective endocarditis, i.e., which nursing intervention should be included in the initial plan of care? Consider the choices. A. Initiate contact and droplet isolation precautions. B. Obtain a prescription for intravenous antiviral medication. C. Obtain a prescription for enoxaparin. D. Monitor renal function. The correct answer is option D. Monitor renal function. Infective endocarditis can result in septic embolization, where fragments of vegetations from the heart valves break off and lodge in systemic arteries, including those in the kidneys. This can cause renal infarction, which may present as flank pain or hematuria and lead to renal failure if not promptly recognized. Moreover, the long-term intravenous antibiotic therapy used to treat IE can also be nephrotoxic, making renal monitoring essential.